Welcome to the Wellness Abundance Podcast. I'm Melissa King, your podcast host, board certified health and wellness coach, certified personal trainer, and founder of Wellness Abundance Coaching. I created this podcast to help women like you learn more about your body so you can age gracefully and navigate the different seasons of your life effortlessly. If you're a woman searching for answers to unexpected weight gain, intense PMS, chronic fatigue, fertility challenges, PCOS, brain fog, and more, this podcast is for you. We'll do a deep dive into all areas of women's health and connect with experts so you can get clarity on what's happening within your body. This will empower you to take control of your mindset on the natural aging process and create flexible lifestyle habits that work for you at any age. Now, grab your favorite glass of wine, cup of coffee, or mocktail, and enjoy the episode. All right, welcome back to the Wellness Abundance Podcast. I'm your host, Melissa King, and I have my wonderful guests with me today, Dr. Mallorie and Dr. Allea. They are co-founders of Tonic and Phasic, a physical therapy practice. And I'm just going to dive in and give both of you the floor to introduce yourself, and then we'll dive into what we're going to talk about today. Does that sound good?
Very nice.
Sounds good. I'm excited.
Cool. Awesome. Me too. So whichever one of you want to start first, go ahead and share just a little bit about yourself, what inspired you to get into this field, anything you feel like our audience should know.
Yeah, I'll go. So I'm Dr. Mallorie. I'm a pelvic physical therapist, and like you said, the co-founder of Tonic and Phasic. I'm also an herbalist, so I do a lot of nutrition and herbal components within the practice. What really got me into the field, couple things. The main thing that my passion is within it is unexplained pelvic pain. It's because I experienced a lot of unexplained pelvic pain. I had a lot of period pain, a lot of constipation, pretty much a lot of the pelvic health symptoms, but I didn't know any of it. And nutrition was really the one that opened my eyes and lens to how to just navigate it a little bit more, which is how I got more involved in the nutrition round. But from there, I found out I was already an orthopedic physical therapist working with more sports specific injuries, ortho injuries. When I found out we had a field, I was like, what in the world? I have to get into that, because not only was I experiencing that, my mom was. She has endometriosis and interstitial cystitis. My sister was going through infertility. So it was just like a big familial thing, and it just didn't make sense to me. And when I found out we had a field for that, I dove straight into it, worked into hormone health, nervous system regulation, went into the herbal route, and try to get that full encompassing, I guess, view on what is really going on with the body, mind, and soul. So that's kind of what led me into the field.
That's great. I love that you were in the sports therapy, physical therapy realm first. That's actually a field that I wanted to get into when I first started. Like right before we recorded, you had asked me, Dr. Mallorie, how I got into this. And that's one of the things that I considered that path, sports medicine or, but it's cool. I've always been fascinated also with how the body works and everything. So cool. Awesome. Thanks for sharing.
Of course.
Dr. Allea, how about you? What brought you here?
Yeah, so I am Dr. Allea. I have been so passionate about women's and pelvic health. I was actually thinking about this yesterday. I was like, probably since middle school and health class. And I was like, why are we so afraid to talk about our menstrual cycle or talk about sex even, right? And it was so taboo. So I think I was probably naturally drawn to it. And then I noticed that there was a women's health, pelvic health, and I was like, well, perfect. I've been talking about this my whole life to my girlfriends, my family members. And so I thought, I was like, oh, I'm going to just be helping people who are in their pregnancy journey, postpartum, incontinence. And then it just turned into something so much more. And so in this clinic, we were treating a lot of pelvic pain. And I realized, I'm like, wait, I have pelvic pain. I've been having pelvic pain since middle school, which is why I was so passionate about it. And so then I was like, wait, this is how people are feeling. And I could really relate to them. Like if they were having burning symptoms or any kind of general pelvic pain. So, like Mallorie, I myself also had pelvic pain. So I just felt like I could relate to patients on such a whole nother level of just validating and helping them walk through this journey that they're not alone. And so I was in PT school. All my capstone, all my projects, all my focus was in pelvic health. And then immediately once I graduated, I was like pelvic health girly, and I'm still here. So
Yeah, I totally agree with you that we need to just not make the whole topic of women's health taboo anymore.
for sure.
And just normalize it. Like let's just talk about it. Let's just talk about our periods and let's
Put it out
talk
there.
about the challenge. Exactly. Put it out there and just let's talk about like the different phases of a woman's, you know,
Because it's so fascinating. Like when you learn about it, which is like, I feel like I learned about it way too late in life. And I was like, I feel like I cannot wait if I have children, if I just to teach them about it because it's so empowering.
yes, I agree. It's interesting too because I've met women who are like my age in their mid 40s and they don't know when they ovulate throughout their cycle.
Oh, yeah.
And it just like that to me when I learned that a couple years ago, I was like, wow, like this is why we as women in this space need to continue doing the work that we do because it's super important for us to you know
Yeah, it really does. So, I do chart interpretations. So, a lot of the times when people come for like infertility experiences, not everyone, but some people, right? You listen to what the typical guidelines are. You ovulate on day 14. But people that I see when they're ovulating on day 24
Mhm.
and they're trying from days 13 to 15 or 16, even let's say 17, 18, and they're like, I'm not getting pregnant. And then you watch their cycle and it's like, well, because you're not ovulating during that time. But unfortunately, they go through a lot of, the medical system and they go through other extra steps that they probably didn't need to go through if they knew that they're just a late ovulator. And that's still healthy if they're ovulating consistently during that time
Mhm.
and they're not having that like constant spike and down, spike and down. That's a whole different thing. That's more like PCOS stuff going on.
Mhm. Yeah.
But if they're just like a late ovulator every so often because of stressors in our life that we can't remove, life has to have stressors, then it's something that it's just to be mindful of. Like, when are you ovulating?
Mhm.
Hmm.
Yeah, what I talk about in my program a lot too, and on my blog posts and on this podcast is like the the follicular phase and the luteal phase, and when you ovulate, and when your hormones are should be at their peak and then low. This is all just textbook, what we
Hmm.
know, what should be normal, but this is why you have to really track your cycle, how you're feeling,
Hmm.
everything. Now, you don't have to do it all the time because I'm not a fan of tracking food and
For sure.
I'm I it doesn't work for me personally. I know for a lot of my clients it doesn't, but I can you could everyone can do it temporarily just to kind of get to
Hmm.
know their body. So,
Yeah, I
especially,
agree.
yeah, when they ovulate, especially, if they're having a hard time getting pregnant,
Mhm.
it's really important. So, great. So, let's talk about the pelvic floor since both of you are pelvic floor specialists, pelvic health specialists. So, I don't know where you guys want to, where either of you want to start with this, but if you want to start also, maybe we could just start with just like, what is the pelvic floor? Because I feel like this is a topic that, again, a lot of women are not knowledgeable about. Like, some women don't even know what their pelvic floor is,
Mhm.
where it is, what it does. We know about Kegel exercises, but from the research that I've done, Kegels aren't really that effective, but you guys would know better. But yeah, so if you could just want to start out by sharing, like, what is the pelvic floor?
So the pelvic floor is a group of muscles. We think about these muscles just like any other muscles in our body, right? And so when I'm introducing the pelvic floor, we typically have a pelvic model. I'm such a visual girl, but because we're on a podcast, we can actually, do you have?
I'll show you while she's talking.
I love it. Yeah. We've
Yes,
got one.
love this.
Yeah. Okay, I love this because I was going to totally improvise, but if you are at home and you're just listening to it and don't have access to the visual, I can walk you through as well. So on the podcast, Mallory's holding up the pelvis. And so this is the front view of the pelvis. So at the top, we have our waist bone. So if you're sitting down right now, you take your two hands and you just place them right at your waist. And those bones that you hit on, that's the top of the pelvis. And then if we just inch our hands towards the midline, we're going to hit right on the pubic symphysis. And this is the joint that connects the front of the pelvis. And then we have those little hip sockets right where Mallory's hand is covering. And this is where our leg extends. So where our hip is coming in and articulating with the pelvis. And then we have the bottom of the pelvis. Yep. Which are our sit bones. So when we're sitting down and we wiggle back and forth, those bones that you're feeling from left and right side, those are those bones. And so I'll flip it to the back. Now we have the back side. So those two top bones, those are your lumbar spine, L4, L5, and then we have the sacrum. So if you put your hand on the flat of your back, you land right on that sacrum, and then you inch your hand down and the tip of your finger will land on your tailbone. So all of the red that Mallory is showing is the pelvic floor. And all of those bones that we just described are the pelvic floor muscles attachment points. And that is very important on just the movement and biomechanics of the pelvis. Our pelvic floor is often a stability muscle, but it has so many other functions with it as well. So we have the front of the pelvic floor, and those muscles are more superficial. And so, if you were to again take your hand and if you feel comfortable with it, you can actually palpate these muscles, touch these muscles right outside your pants. And so, these muscles, their main function is a sexual or penetrative function. So, these muscles have to be able to lengthen to allow for tampon use, speculum exam, ultrasounds if you're going through IVF, or even birthing purposes. These muscles need to be able to stretch. And so Mallory said this really beautifully yesterday. We were at a event. The pelvic floor is so vast. We have all the way from a function of stability where we use it from walking and moving and getting in and out of our chair to intimacy. So there's a wide range. And so these muscles we have the clitoris at the top. You got it. And then the urethra right underneath it. And then again, we have those superficial muscles and they wrap around the vaginal opening and the anus. And so then we have the deeper part of the pelvic floor, which is more of these internal muscles. And so their main function is sphincteric. So when you say Kegel, we're thinking of these more midline muscles, and they close to store urination or bowel movement. And then in order to eliminate, they have to open and relax. And so they're kind of like this horseshoe shaped muscle. And then we have the more lateral sides of the pelvic floor, internal, and these are more for support and stability. So they help keep our pelvic organs in place and they help stabilize us from the inside out. So they are working with our abdominal muscles, our diaphragm, our back muscles, our hips, to create this closing effect. So, like I was saying, it's this vast functionality of the pelvis, but in a nutshell, in a 101, that is the pelvic floor. And you can add to that too, Mallorie. I know you could have your nuggets of information too.
Yeah, the only thing I'll add is the support system for the organs themselves.
Mm-hmm.
The bladder will sit right behind that pubic bone, so it sits like this. Now outside, I don't have the rectum, so right here we have the uterus, bladder, and then rectum's right here, and it kind of goes like this, like a little L shape right below it. And these guys are all tethered around each other with a ligaments. There's a really cool picture that shows them like really hugging each other because that's how close in nature they are. And that's very important to know how close in nature they are because they all impact each other. Someone who's constipated could have bladder symptoms. Someone who has period pain could feel like they have to go pee all the time. Someone who has constipation could have period pain. So they all influence one another because they're so close. And the walls between them are so thin. And you can think of it as your cheek. So the inside of your cheek, right, that tissue is like inside our vagina, our vaginal canal. And so if I were the rectum and I'm constipated, I'm going to be pushing inside that vaginal canal, making it harder, more uncomfortable. The muscles might contract. So that's just like a little nice image I like to give. But the other important piece to that is everything that she was saying, the attachment points, all the ligaments, for the most part, not all, but most of them, attach the sacrum. So because of the interconnection of the sacrum, the hips, and the lumbar spine, and even we can go up and down the chain from there, your foot, your knee, your neck. But let's just focus in this area. One thing can impact the other that then can impact the organs and that can impact the pelvic floor. So those, when we're trying to look at people from a pelvic floor perspective, yes, we want to start here. And the question you asked about Kegels, we want to start there. We want to see, like, can they do it? What does it feel like? Can they even connect? Because for the most part, people who cannot Kegel can't feel. They have a hard time, like, being like, am I doing it right? Can I feel it? And so the most important part isn't to strengthen the pelvic floor by a Kegel, but to connect you with your pelvic floor by doing a Kegel so you can feel that. And most people, it's called a PNF technique, which is like a neuromuscular type of technique that we use, which is a contract, relax. And for some people, in order to learn how to let the pelvic floor go, they need to learn how to contract. And so in that case, yeah, Kegel, so we can feel that, but let it go. Can you feel that let go, that pelvic drop? Or for other cases, some people call them a reverse Kegel. So we start there, but we do not end there. Because like we've been saying right here, this connects to everything else. And for the most part, weakness here is probably because you have tight glutes that can't lengthen. Maybe you're lacking internal rotation, so you can't get the full depth of the pelvic floor. Maybe you have very restricted obliques, and you're then compressing and putting pressure down into the pelvic floor, and you can't utilize it effectively. And then we can go all the way down to like what's called valgus in the knee, where it kind of caves in. So biomechanics are not appropriate, which is causing pelvic floor symptoms. So yes, in summary, 101 of the tissue, start here and don't end here. We go outside of it.
Okay. Wow. Thank you for sharing all that.
Yeah.
This really kind of helps me have, and I hope, our audience, a much better understanding of the pelvic floor and exactly what it does. So based on my education and my training as a women's fitness coach, like I mentioned in my email a couple of days ago, that I have some basic understanding of the pelvic floor. I know it supports the organs, and I know it's important, to have that support, ab support, all that good stuff. But that really emphasized like really how important it is to really, maintain it, because it affects so much. And that's with everything in our body. You mentioned like it can go all the way down to the knee. And I know you mentioned there are other connection points, but really like lower spine, but everything is connected in our body. And I feel like that's why it's super important to take care of your whole body, not just, like when I program workouts for myself and for my clients, they're full body workouts. It's not like we do an arm day and then 2 days later we do a leg day or whatever. We do full body workouts basically every workout. That way we make sure we're hitting all those and everything's connected. So what do you find as professionals in the pelvic health space are the most common issues that women have?
That's a great question. And I also feel like I mean, the statistics are honestly like almost every single person has experienced some kind of pelvic floor dysfunction in their life. And so you can think about leakage. You can think about, you can essentially separate into pain, non pain, painful pelvic floor dysfunction. Non painful pelvic floor dysfunction could be leakage with coughing, laughing, sneezing. It could be heaviness, pressure, and sometimes that could be uncomfortable. But then on the pain side too, you could have pain with sex, pain with insertional activities, just general orthopedic pain, the endometriosis, the IC that Dr. Mallory was talking about. Um, and there's just a whole constipation. I feel like I could go on like a list. And so I feel like we've all probably have experienced constipation to some level in
Mhm.
our life and how uncomfortable that could be, or even like period cramps, right? So
Yeah, yeah, and you can look at it through like the lifespan too. Like teenage years, we're thinking about like or like young adult, not young adult, like elementary to middle school. You can think bedwetting, constipation, stomach aches. That's all pelvic pain. You can think in like teenage to young adult years, intercourse, periods, bladder pain. You can think genital pain, like vulvar burning. You can think if you have a penis, testicular burning or testicular, just like pain, tip of the penis, clitoral pain. Um, I mean, you can even then go more into like birth. And when you're pregnant, you can have SI joint pain, pubic bone pain, low back pain. That's all considered pelvic health. Most of the time, people go to the ortho approach, which, to be honest, it could get better. But most orthopedic physical therapists are now trying to like incorporate the pelvic health referral part because you'll get someone for like 6 months, 8 months, and if it's low back pain or hip pain, I mean, we should see some changes by 3 months. Musculoskeletally,
Mhm.
tissue does change within 3 months. We see that. And if someone's staying with like an orthopedic specialist because of their back pain, a referral to a pelvic floor PT would be nice because that obturator internus, which was that side muscle inside here, it's an ally of the pelvic floor. It's not a pelvic floor muscle. It's a hip muscle, a deep external rotator. And that can refer up to the lower abdomen, but it can also refer towards up to our back too. So
down
sometimes,
your thigh.
yeah, down your thigh, they're just
Mhm.
temporal patterns. And so in our clinic, we see a lot of our specialties complex pelvic pain. So, like a lot of pelvic pain symptoms unexplained. Either you have a diagnosis or you're seeking a diagnosis. And then we also see birth prep, postpartum recovery, getting them ready to return back to their body, their new life, get oriented with their new tissue, and then really strengthen on top of where they are going to want to be. And then we see menopause too. So perimenopause,
Mhm.
menopause, a lot of pain with sex in menopause. People can still have sex in menopause, and a lot of people don't because of the pain and it's uncomfortable.
Mhm.
So we teach like how to nourish that tissue, support that tissue. We work with gynecologists to refer them out if they need any like estrogen cream, if that's the case. If not, we do the herbal route where we can use calendula or coconut oil or whatever on that tissue to nourish it. So yeah, I mean, if you have discomfort or symptoms from the diaphragm down to the pelvic floor, pelvic health, something to look into.
Okay, great. I'm glad you actually just brought that up because my next question was going to be like, how do you know when to go see like someone like yourself or a gynecologist, or just to get your pelvic floor checked out? Because I know sometimes, like, I've never had kids, never given birth, but I know sometimes, like, if I laugh too hard, or there will be like just a little pee that comes out, but it doesn't happen very often. So maybe that's just a one-off. But what kind of frequency would you recommend a woman going to get checked out?
I feel like it should be important for every single person who has a pelvis to have an assessment. I think just from a wellness and preventative perspective, just because we want to tackle it kind of before it gets worse. So even just going with like the little bit of leakage, we know as we age as women, our tissue may become more dry, or it may not be activating as much as it was in our like 30s or 40s or 50s. And so I personally like when people come in like it's just a little bit. I'm like, perfect. Let's just like kind of
Yeah.
tune things up. Let's refine the movement patterns so we're not kind of chasing this 10 years down the line. But yeah, I think it's really important for people to come in once they are starting to feel dysfunction. But I think before you even get to that point, it's almost kind of like this tie back of like decreasing the stigma around it, because we want to be familiar with that area and like what those symptoms mean. And like we talk a lot about burning, right? And if something is burning in your genital or pelvic region, you're like, no, like this is not good, right? Or you just are like, okay, it's just going to go away on its own, right? So we want to become familiar with that tissue first. And I think Mallory has explained it so beautifully yesterday and like in the past too, about like a muscle that is really tight and you stretch it, right? And you can feel that burning sensation. And like we described earlier, is the pelvic floor is a muscle just like any other muscle in our body, and it has those properties as well. They just may feel a little bit more or a lot more intense because of the neurovascular input to that area. So
Mhm.
I do feel like we just have to create this familiarity with the pelvis and the pelvic floor and those sensations that those organs can bring, and kind of destigmatizing that. And then we can get to the right provider too.
Mhm.
Yeah. So do you guys do pelvic floor exams in your clinic, or you may have already answered this question, so I apologize if I'm
No, no.
asking a duplicate question, but yeah, so do you guys do those pelvic exams there? Or I guess also another kind of question piggybacking off that is, when you go, say, get your annual exam through your gynecologist, like a pap smear, uh,
Mhm.
do they do anything with that? I guess, I mean, obviously I've had dozens of pap smears throughout my life, but I guess I never really paid attention to like the pelvic floor specifically.
Yeah, so we do internal assessments. That's what really makes us different when it comes to other physical therapists. If you're a pelvic health specialist, most of us, I wouldn't say all of us, do internals. And it's very different from an OB-GYN assessment for multiple reasons. So if you get a pap smear, it used to be annually, and now it's every 3 years, and I think they're even moving up to 5 years.
For
So
Sorry, for a pap smear?
for pap smear,
Really?
I know, I
Oh,
know,
wow. Things are
I'm,
changing.
I know, I mean, I digress because I really think we all should do it annually, but that's just
Yeah.
me. Uncomfortable, but totally worth
Yeah,
it.
it's just a small moment of our life.
Yeah, well, we help people prepare for those. So if you're having a lot of discomfort, there's many like tips we can
Mhm.
give. One of them, I tell them request a kid size speculum.
Oh,
You could get a smaller one. You can tell them, I have pain with this. Can you just give me a second? Let me know when you're about to put it in. And then we teach you on our end how to inhale, how to open, how to allow it to go in, how to take your moments and pause through it. Because what happens is during the pap smear, you're like, ugh, and it's not fun.
mhm.
And they're like cranking and they're opening. You're like, oh my God, hurry up. But what they do is they get a Q-tip, let's just say a long one, and they're just swiping the cervix. They'll look at the cervix and pretty much take it out, take the speculum out. Some OBs then go in and they do organ assessments. So they're looking at like ovaries and uterus, but they're looking for like disease. They're looking for like things that are really wrong. They're not looking for function. And that's where we come in. We look for function. We go very slow because if you go fast, that's going to react a reflux within the muscle, causing it to contract. And so if we just went in so quick and we're like, dee, 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 like not being mindful, and the muscles are tightening around us, we'll be like, oh, you have pelvic floor muscle dysfunction. Not true, because it's not an accurate assessment.
Yeah.
So most of the times we really stay at the opening. Let me see if I can go. I'll go this way. So we stay at the opening. We kind of hang out at that perineal tissue and say like, okay, take a nice big inhale. I'm about to go inside. They inhale and we scoop through with the resistance of their tissue. So if I go in and they're already like, then I'm just hanging out here because that's the assessment alone. I can't assess their tissue because they're so tight. My goal isn't to see like, okay, how far can I go in? It's how are their muscles reacting? How are the muscles responding? Can they let it go? Can they, if I coach them through a couple of things, if I move their pelvis a little bit, if I have them breathe into the rib cage, what happens to my finger? Oh, it's opening. Cool. I can go further. So then I go further. And then we start to kind of really search those muscles. We push on it. We do a thing called pelvic mapping, where we map your entire pelvic floor just to kind of give you orientation of which muscles are tight. Then we might do like little testing techniques like, okay, what if she contracts and does like an adductor contraction? What about a hip contraction? What's happening there? What if I have her contract her core? What if I have her? And we just keep doing the what ifs and seeing what happens. That's the assessment component. So yeah, we give you a pelvic floor map. We see how your pelvic floor muscles are functioning. We see, can you contract your pelvic floor? Can you let go of your pelvic floor? That's the coordination factor. We might want to see like, in a sense, if someone has prolapse or they're leaking, what about when they do a bridge? If they do a bridge, are they bearing down? Do I feel like things pushing on my finger from above, which are the organs? And so that's just like an assessment. From there, if you have extra training, you also can look at the organs themselves. And so that's more visceral components. And we like to look, so if I go all the way deep back, the cervix is hanging out right here. And there's a thing called the cul-de-sac, which is right behind the cervix and where the rectum or the colon area is. And we want to look at those tissue. We can come up and look at the ovaries a little bit. We can look at the fallopian tube, not as much, but you can kind of get to that region. We can assess bladder, urethra. So yeah, it depends on the assessment, how we treat it then. Because the goal is if they're tight muscles, we want to introduce blood flow, get them quote unquote relaxed. If they're lax muscles, then we want to tone the tissue. So just like any other muscle in our body, it's going to go down the same paths after we get our assessment to see what they need to do.
Great. Wow, that's interesting. I never knew. Is there anything you want to add to that, Dr. Ali?
Oh man, I think you did great. I feel like I love treating prolapse. That's kind of my specialty, and I feel like and I love treating like getting back into activity, like specifically back into running or strength training. So the next progression of like that muscle mapping and functionality is testing people in the upright position and through a little bit of their sport, like doing a squat, and albeit will be internal. We're feeling, do we get a closure? Like, or maybe not. Like if you're laying on the table and you can Kegel or contract the pelvic floor and you can relax it, great. But sometimes when we get people upright or in different positions, it's a whole different ball game. And so that is a very interesting piece as well to it, because we live our body upright
Yeah.
in this upright, and we're most symptomatic in this upright position. So that's probably a little unique part as well when we get into like out of like pain and now we're getting into the fun stuff. Then we're like, let's get you upright and moving.
Yeah, that's great. So I'm familiar with prolapse, but can you explain what prolapse is to our audience? Because I'm just going to make an assumption that most people listening have no idea what prolapse is.
Yes. So prolapse is the descent of the anterior or posterior or the apical wall. So Mal, maybe if you could use, so essentially we have the anterior wall of the vagina, and we think of that as the wall that's closest to the bladder, closest to that pubic bone. And then we have the posterior wall, which is the backside that's next to the rectum. And so exactly how Mallory was describing it earlier, our walls are kind of like our cheek, right? And so when people think of prolapse and their organs are falling out, their organs are not truly falling down, but they are descending into a wall. And so sometimes it could be the urethra, the bladder, the cervix, the uterus, the rectum, or even the small intestines as well. And it can happen at different degrees. I will say this, a lot of my job is to educate people on prolapse, because I think when people hear prolapse, they're like, absolutely not, right? Um, but there's always a degree of movement to all of our organs. So our heart and our lungs expand, our uterus has to expand, our bladder expands. So there's going to be some degree of movement. And again, if you've had children, or if you're menopausal, or even if you're hypermobile, you have some degree of mobility to the tissue, and that's okay. It's just if you're symptomatic meaning if you're feeling heaviness or pressure, either in your vagina or in your perineum, that space between the vagina and the rectum, or even in your rectum. Yep. So sometimes people will be like, I just feel like I have to put my hand right underneath and almost like splint and push up, and that like feels better. And so sometimes what can happen is those pelvic organs can shift, whether it's from muscular tension or fascial or ligamentous disruption, or even some nerve too. So that's kind of where we come in with that muscle mapping, where we're like, okay, what's going on? Is this a fascial integrity issue? Did they have use forceps during childbirth and that kind of disrupted some of those structures? Or are they chronically constipated and they've been constantly bearing down onto those structures? Or are they hypermobile and they're a gymnast and they're feeling those things as well? So it's not something to freak out about, but it's definitely something to see a pelvic floor therapist for if you are feeling symptoms, that heaviness, pressure, inability to eliminate, you're feeling those stuck feelings with those organs.
Okay. Thanks for explaining that. That was a really fantastic way to explain it. And I learned a little bit more too, based on my knowledge of
I love it.
So yeah, this is great. Oh my gosh, I'm really enjoying this conversation. I just want to say that because you two are really just incredibly knowledgeable about the pelvic floor, and I'm just learning so much right now. So this is so great.
Yeah, honestly, we
So
love it so much. We can talk so
yeah,
long about the pelvic floor
I
and just
know.
pelvic health.
Well,
Yes,
it's so funny too, because Mallory and I are talking a lot, and we'll talk out to the community, and I keep referencing back because even though I'm a pelvic floor PT, Mallory will say something. I'm like, that literally just like hit home.
yeah.
And that's like such a light bulb moment. I said that to her last night. I was like, that was great.
Yeah,
I was just like, I've been doing this for 8, 9 years, and you said something. I was like, I didn't know that
literally
actually.
same. Like every time we talk, we learn from each other. She'll say something about like the urethra in a way that's striated. I was like, what the heck? That was good.
Yeah, I love that because I that's one reason why I wanted to get into the health and fitness space is because it's studying the body. And there's so much we don't know about the body, and it's literally impossible to know everything. So there's just so much opportunity to learn more, especially from your colleagues. who are in the same field. I learned the same things from my, health coaching colleagues and fitness colleagues. And it's just so, I'm like, I totally geek out on this stuff.
Same.
It's like, oh my
There's just
gosh.
so much. There's
Yeah.
so much, and there's so many niches within the pelvis, right? It's so vast. And so Mallory has her own like niche specialty within our specialty, and I have mine. And then you just really dive down and you're like, I had no idea that our body's like it's like it's a literal miracle. I truly think that all the time.
Yeah,
So
the intricacies, honestly.
Yes. I totally agree with you that our body literally is a miracle. And I tell my clients this all the time. Like when we give our bodies the appropriate input, it will provide us with the optimal output. Like if we treat it the way it wants to be treated, it can do wonders for you and your life. Um, so is there anything else you want to share right now before we kind of move on to solutions and how you ladies would treat any specific, dysfunction? Anything you want to add before we move on to that?
Nothing that's coming
I
to me.
think I think I'm okay.
Awesome. Cool. So let's dive into like, how do we treat these pelvic floor dysfunctions? You don't have to talk about everything. Obviously, I know we could probably be here for hours, and I mean, there's so many different conversations we could have like down the road about this topic. But what would be, maybe if you want to talk about like the most common pelvic floor dysfunctions that you treat and how you treat them?
Okay, so let's start at a step right before that, and then we'll give like kind of like examples, one or two each to kind of like fit what we're trying to do. So when someone comes in for assessment, we don't just look at the pelvic floor. We categorize it into four different kind of structures. So the first little box that we kind of look through is the typical physical therapy stuff. It's the structural system, ligaments, bones, tendons, muscles, breathing patterns, stuff like that, nerves. From there, after we figure out, okay, these are the things going on in that area, like the hormonal system, um, period cycle, where they are in their transitions, like if you're postpartum, menopause, just started your period, menarche. Then we look at cortisol, thyroid, all that stuff. Maybe they have previous labs. From there, we look at the nervous system. And with the nervous system, we're trying to think, is there any stuck emotions? Is there, the polyvagal theory, stress responses, fight, flight, fawn, freeze? How long have they been in pain? Because pain is an emotion. How long has it been stored in their body? And what's the relationship to pain? We look at vagus nerve, vagal toning, how do they respond to calming? Because sometimes that can be upregulating when we start kind of getting you to get more grounded. Look at that. And then the last part is systemic gut immune inflammation. Any referrals, any doctors they've already seen, what are their notes saying? What have they been diagnosed with? And we take that whole thing and we call it like this pelvic blueprint where we're trying to really figure out what is going on. And from there is our treatment. So to not get into each of those, one of the main treatments, let's just go under the physical therapy component. Actually, I can give you a little bit of both. I'll give you like teasers and then exactly what we do. So let's say under the structural system, we might do movement screens. We might do mobility work, strength training, endurance training, breath work, manual therapy to really open up tissue, get input into the tissue, talk to the nervous system, however that goes. Hormones, we might be cycle charting, using nutrition, herbs, supplements. We might request more tests, like give them referrals to go see other practitioners, get more testing. Recommend estrogen cream, stuff like that. So we'll go and refer them to a gynecologist. For the nervous system, like I said, we might do vagal toning. So teach them a lot of stuff, how to go like right behind the ear. We might do it manual therapy based, compression on the sternum, having them breathe a little bit, some tapping maybe. We might integrate more like a paper processing therapy where we're really trying to process all the pain, heaviness, and emotions that they've been experiencing with what they've been going through. And then on the last end, we can do specifically for pelvic health only. We can run some functional labs if they can't get it through insurance. Ours is not through insurance, but we can go through a third party to kind of help them get that and help them interpret and coach them through those numbers, like a GI map, Dutch test, cortisol testing. So after we get all those things, we see them for some time, and then we create a literal plan of care to like have them hit some markers. That kind of takes some time. So if we go back to the first set, the structural system, physical therapy, what we do, I'll take you through someone who has painful periods. So if they have painful periods, I would have them do abdominal mobility. So I'll have them probably, let's do some castor oil, do some just general swipes around that uterus, pull and push on top, put some heat on that when you're not on your period, like a week before. And then I'll give them mobility drills, maybe like a child's pose, maybe putting their legs elevated into a 90-90 position and breathing into their back. I might have them put their legs on not a Bosu, a physio ball or yoga ball, have their legs in that 90-90 and just swivel side to side. Might have them do more like knees to chest. So it's more like down wriggling. Now, outside of their period, I might have them do more kind of what this is. I wish this can move, but more mid pelvis mobility. So have them really rotate, and that's lateral movements. You can think like a lateral lunge, um, kind of like a hip flexor stretch, moving the legs kind of in opposite direction. That's going to help mobilize the sacrum, which in theory indirectly can mobilize the uterus. So that's something that I would do for painful periods. What about you, Allie?
Yeah, I think that was great. I was like, oh, I love this. I love those techniques. I may actually use some. Um, I'm trying to think, okay, so I always like think of like case scenarios. So someone I'm seeing, they want to have a child. They want to go through IVF, unable to get pregnant. And so as she's going through the history, I'm realizing they don't have intercourse, actually. And I was like, wait, this is interesting. She's like, well, it's so painful. And I was like, oh, so we haven't, because she was sent because she couldn't complete the transvaginal ultrasound. But in reality, we haven't even given intercourse a try either because there's just so much apprehension, so much fear. And there's vaginismus, which is essentially pelvic floor spasms, and even like those external muscles that make up the vulva, the internal, they're so tight. And so we kind of are dabbling into those pillars that Mallorie has described earlier, but there's a really strong emotional, spiritual component to it as well. And then there's those structural sides. So I personally like to ease into this because it's going to be this more of a complex, not necessarily straightforward. There's some ideologies, there's some demographics as well that are involved that I have to take into consideration. And so a lot of the beginning parts of therapy is just building trust, just doing some vagus nerve. I start, even though the symptoms and the dysfunctions down there, I start here. I start on like these like I call them like green flag body parts where people may not be ready to be touched in their abdomen and their low back and on their legs. So there's this trust that we build with our manual therapy. She's getting used to my hands. We integrate into breathing and just the mechanics of, okay, if we cannot stretch the pelvic floor and if we don't feel comfortable with that, then how are other ways that we can do it? We can do the mobility exercises similar to what Dr. Mallorie was saying. We can get into breath work. We know that the diaphragm and these deep breathing techniques can actually influence and ground the pelvic floor as well. So that immediately gives someone to say, like, okay, I don't have to touch that area to make progress in that area. And I think that's so empowering in its own. And they're building trust and familiarity and the sensations in their body. And then once that trust has been built and they are ready and they consent for the pelvic floor treatment, or even just like in the abdominal region or the pelvic floor, then we will go and start just doing some sensory work. Just them getting to know their own body. We do a whole anatomy, like this is what's going on. Let's look at your vulva. Let's look at the tissue integrity. Let's get familiar with this body part. And then we start to integrate into stretching this muscle. Now, this is dependent on so many things, but some people would be like, kind of speed through that process for like the first 4 weeks. Some people, it takes like 3 to 6 months to get to that point. And it is their journey, and I am just here to support it and guide them whenever they are ready to take those steps, because it's such a huge deal when
Mhm.
people who have pain with intercourse or pain with intimacy and they're trying to build a family, and we just want to again get familiar and feel empowered in those parts of our body. And I think it's really important too, even postpartum, right, of like what that tissue once did look like and what it looks like now, just to make sure that, we're just staying on track with the changes of our body. But so we get through the manual therapy, and once someone could have successful, enjoyable penetration up to their calling, and that's kind of where we end, is like once their goals have been met, they don't have pain with intercourse, or they can take what they've learned here and kind of fulfill that on their own. Like if it's taking a while, they're like, I've got the tools, I know what to do, I'm consistent with it, I just have to do this on my own. Or then also too, maybe there was those like the spiritual, there was the more emotional piece, and then we can be like, okay, you know what to do from the physical, the structural side, and we've worked through some things together. Now I think it's out of my scope, and I think we need to refer for you and your partner to now come together and connect on that emotional, build that foundation.
Mm-hmm.
Yes, absolutely. All of that. I love that. And I love, Dr. Mallorie, what you said. I'll start with kind of sharing my thoughts on what you said is like the mobility and child's pose with like heavy periods and just, really just in general when you have, heavy menstrual cramps
Mm-hmm.
or, intense menstrual cramps or even just any at all. I know that's been super helpful for me when I'm experiencing that, even if they've kind of lessened a little bit and they're not as painful. But, and that's one thing when I'm working with my clients, training them, I like you, Dr. Ali, really kind of ease into the whole conversation because periods, pelvic health, fertility, painful intercourse, those are all very sensitive, emotional topics for a lot of women. And I just really like how you both how you navigate that. And you're just very aware that I need to build trust with this patient because you know, like I said, it's a sensitive topic, but it's also something really important to address and, to treat. So I treat my female clients the same way. I do have some male clients in a group fitness class I teach regularly, but same thing with my clients. Initially I let them share what they want with me. Like, oh, I'm like, how do you feel today? Before the workout. Oh, some women will be like, oh, great. They're always feeling great. Other women will be like, oh man, I started my period last night and I feel so crampy.
Mm-hmm.
Then I can, like you mentioned, Dr. Mallorie, do maybe some more mobility and maybe make some adjustments to the workout. But yeah, it's such a sensitive topic. I feel like just infertility these days is just way too common that um, we need to treat it with a lot of respect and
Mm-hmm.
really empathize with.
validate
to them. Validate,
for
yes.
sure.
And that's difficult. That's how I've been trained to, like, with health and wellness coaching and also with my fitness training. But I mean, it's something that I feel like I could be more aware of, especially in my, personal relationships, outside of working with my clients, but my personal relationships. It's important to really just practice that, validating the other person's feelings, whoever
Yeah.
it is.
Yeah, just very much listening. Everyone
Mhm.
has a story and just really sitting there and it's like not feeling bad for them, it's feeling with them. That's
Mhm.
like the biggest thing.
Yeah.
There's no need for that other part, but like there's a lot you can feel it. It's in the air and being aware of what their past has been, their journey to get to anyone with pelvic health experiences,
Mhm.
their past journey. Some of them are so blurred too. It's so deep in there that could be even a form of medical trauma, right?
Yeah.
Just going through so much that they just forget everything. And once you start to ask questions, because you truly care and you want to get down and you're curious about them as a human, not just them with their pain. So when you get very curious and you ask these questions, you know, emotions will start to kind of build up too. So then it's holding the space for them as they're feeling the emotion to not just change the topic and be there with them as they're experiencing such heaviness. So it's I would say, a very intimate thing we do. I mean, we're
Mhm.
already getting personal and intimate doing internals. So the whole entire experience has to be as intimate as it can be, as open, as
Mhm.
soft, as nurturing, but very kind of guided because that's our role in that to help them figure out what they can do, where they can go, how they can really overcome what they're experiencing.
I feel like it's just a really holistic, like, perspective that we have to
Mhm.
take, when treating this intimate part of our body. Like, you have to be aware of, like, the mind, body, and soul in this part.
Yes. Yes, exactly. And I love, Dr. Mallory, what you mentioned about the emotions in the body, the
Yeah.
emotions being pain in the body. And I truly believe that. I was just talking with my husband the other day about this, and we got on the topic of this, like, carrying your emotions in your body,
Yeah.
and pain pain being the response
Mhm.
or symptom, however you want to label it, from those emotions. And that's why I'm a big believer in, creating this team of professionals, health and wellness professionals, to
Mhm.
really help you overcome all those different, like you guys mentioned, you refer out a lot. I do that same thing. I will tell my clients, this is not my expertise. I'm not qualified to do this, to talk more in depth about this. But so, what else would you both like to share before we wrap up our conversation about pelvic health? Anything about your practice, how you guys work with
Mhm.
your patients, anything?
I'm not sure if I said where we're located. We're located in Costa Mesa,
Mm,
California, but we also do virtual pelvic health coaching. So if you're not local to California, we help guide your experience. So either we can teach you virtually how to stretch the pelvic floor, how to
mm,
move through pelvic pain, help you get referrals from different states and different people to see. We're such a small field. We kind of know a lot of
mm,
people around here. That's not just from California. Um, we do like the nutrition coaching, all that stuff. So we can do that through virtual components if you're not in the area. And if you're far from Costa Mesa, like you're in California, we can still do pelvic floor physical therapy virtually as well. That's telehealth, which would be different from the pelvic health coaching.
mhm.
It would still be the same kind of essence of the pelvic health coaching. It's just that you can get a little bit more because you're in California where we're licensed.
Mm.
Mhm.
Okay, great.
I think the thing that I would add for anybody listening is if they think that they have pelvic floor dysfunction or if they are unsure, or if they even have pain, I just want people to know that there are people that care and that there is support and healing is possible
Mm-hmm.
at any point in the journey. There's some really great resources, and just it's hard to navigate. It's a really hard system to
Mm-hmm.
navigate, and that is why Dr. Mallory and I collaborated and became a team, was because we saw how much people struggled. And so I just want people to know that there are people out there
Yeah.
that are really good at what they do and that are there to support and validate the experience and really just be like like a part of their team, like their trusting team. Because I feel like it's so hard to trust people
Mm-hmm.
in healthcare. I know that sounds really bad, but there are people that
Mm-hmm.
truly want the best outcomes,
Mm-hmm.
and just to like live their life too. I think that's a human right, is to feel
Mm-hmm.
good in your body.
Yeah.
Mm.
And to like add to what Dr. Allie's saying is, you know, we we want to help you the best that you want to be helped as well. And if it's not us, we refer to other
Yeah,
pelvic floor physical therapists
for
too.
sure.
We love our community.
Mhm.
If we really think that you need in-person services, we'd be like, go see this person specifically. She lives, and it could be in California. We're like, she's in Pasadena, go see her. She's in Long Beach, go see her. We're in Costa Mesa. We're very close to those places. So our goal is to never just keep you with us. It's to really give you the best help, improve your quality of life.
Mhm.
If you're driving 5 hours to see us and there's someone closer, I mean, by all means, if you like us, keep coming. But if you want to go
Sure.
closer, like there are other people, and it is hard to find. So that's why we help get you connected with that. If you're not finding the right people, it's just we're really hard to find.
Yeah.
A lot of us.
Yeah, I agree. And I think a lot of that has to do with just social media. There's so many quote unquote health experts on social media that it's difficult to,
Yeah.
like how do I know if I could trust this person? It's
Discern
and
whether they
Mm-hmm.
yeah,
are
it's
legitimate.
so hard to to figure that out. So I definitely feel like you two are both very trustworthy, and um, I'm happy to refer anyone to you down the road. And this is and I just got that feeling, just by visiting your website too. Sometimes you could tell also, even I know I said, it's hard to tell online, social media, but just visiting your website, it's just very warm. And just talking with Marissa on your team, you could just tell, you kind of get that vibe from people,
We
when
love
it's
Marissa.
really, oh,
Yeah.
oh my gosh,
She's such a light of a person.
she is so sweet. We had such a great conversation when we initially connected. But yeah, it's really, it's difficult to find someone who is actually, it's also hard too, because this may not be the case in your field, but I know in the health and fitness coaching world, there's a lot of certified health coaches and a lot of certified personal trainers that actually don't, they work differently than I do.
Mhm.
I don't want to, put anyone down. That's never my intention, but it's not as personal and as customizable. Um, because I've talked to a lot of women who have been through other fitness programs and worked with other like nutritionists, and they just have a bad taste in their mouth from
Yeah.
it, which I get. Um, so it's important for I always tell people, like, if you want to work with me, if you feel a connection with me, that's fantastic. I'd love to work with you. If you want me to refer you out, I'm the same way. I refer people
Yeah.
out too. If I'm like, ooh, this is like not my wheelhouse, I'm really not trained with this specific, challenge you're having. So let me refer you out to someone else. But so many women need our help these days. Like I know you guys have both mentioned that there's enough for, we need more people like us, more women out there like us, promoting women's health, helping women to feel their best. So, yeah.
Yeah. I feel like there's millions of people and there's not a lot of us.
Yeah.
There's just like, I think there's like less than like probably like 20 pelvic health PTs in Orange County, and there's a million of us in Orange County, and everybody has a pelvis for the most part. But
Yeah, exactly. Exactly. And that's kind of how I feel too, being, in the health and fitness space, is it's healthy for everyone should be able to work out.
yeah,
Whatever that looks like for them. Everyone should learn how to eat healthy. Everyone should learn how to create these sustainable lifestyle habits that work for them. So, there's millions of people on this planet, and it's like we need to all band together to help everyone.
Yeah, I will end with this. I feel that because the question you asked, I think previously was like, when should someone come see a pelvic or physical therapist? And to be honest, like what you were just saying, there are resources out there. So read the blogs, go on Google, look up some articles, read what we're saying, go on these podcasts, listen to these, try the things we're saying. And if it works, freaking great. Like you don't have to see a pelvic or physical therapist. But if you're doing something and it feels weird or it's getting worse, or maybe you're just curious and you want to know, come and see a pelvic or physical therapist, but use the resource out there. There's a bunch of books. A book changed my life, and I didn't mention that in this one, but Roar by Dr. Stacy Sims literally changed my life. Love that book. Love her.
I love her too.
Yeah. And so from there, I was just like addicted to just books. I'm like, oh my God, all this information. There's so many books. We can list off plenty of them. But if you're interested in sports and exercise science and just fitness with your menstrual cycle and how to support period pain so that you can be active and move, that book is great.
I'll have to check that out. I haven't.
Oh, it's so good.
Yeah.
You're going to love it.
Okay. I haven't read any of her books. I've listened to a bunch of her podcasts. A health coaching friend of mine, she's an endurance athlete, and Stacy Sims is big in the endurance world. So one of my friends was like, oh, you got to listen to Stacy Sims.
Yeah. She's great.
Amazing.
Yeah, she's great. So I'll have to check out that book, because I'm like, ooh, what more can I learn? You know? So, all right. Well, thank you so much, Dr. Mallorie and Dr. Allea, for joining me today. I'm so grateful. I know you both are busy women, so I'm just incredibly grateful for you to just carve out this time to spend with me. And I'm always open. If you guys want to come back on, you're always welcome. There's so many things we could chat about. So if you think of something, let me know and we'll get you back on. So
yeah, thank you so much for having us, Melissa. It was so much fun. Like we said, we could talk about this for hours.
Yeah.
So
thank you for having your time and sharing this platform with us.
Yeah, of course. Yeah. Thank you for joining me. All right. We'll see you guys later.
Bye.
The Wellness Abundance Podcast is sponsored by Wellness Abundance Coaching. At Wellness Abundance Coaching, we help women create flexible nutrition and fitness plans that fit into their life to help them lose weight effortlessly and navigate the different hormonal seasons of their life with clarity, empowerment, and flexibility. We offer one-on-one and group health and fitness coaching. To learn more about how we can help you navigate the different seasons of your life and become the healthiest version of yourself, schedule a time to chat with us by visiting melissaking.net.